Hello everyone. My name is Diana Cruz Temporado and I will be discussing about the dialysis. Let's define dialysis. Dialysis is a treatment for people whose kidney are failing. When you have kidney failure, your kidneys don't filter blood the way they should. As a result, waste and toxins build up in your bloodstream. Dialysis does work of your kidneys, removing waste products and excess fluid from the blood. So, who needs dialysis? Patients are people who have kidney failure or end-stage renal disease or ESRD may need dialysis. Injuries and conditions like high blood pressure, diabetes, and lupus can damage kidneys, leading to kidney disease. Some people develop kidney problems for no known reason. So kidney failure can be a long-term condition or it can come on suddenly or acute after a severe illness or injury. This type of kidney failure may go away as you recover. There are 5 stages of kidney disease. In stage 5 kidney disease, healthcare providers consider to be an end-stage renal disease or ESRD or kidney failure. At this point, kidneys are carrying out around 10% or 15% of their normal function. So, you may need dialysis or a kidney transplant to stay alive. Some people undergo dialysis while waiting for a transplant. So, who do the kidneys do? Or what do the kidneys do? So, your kidneys are part of your urinary system. These two bean-shaped organs sit below your rib cage on each side of your spine. So they clean toxins from your blood, returning filtered, nutrients-rich blood to the bloodstream. So the waste and extra water make urine, which moves from the kidneys into the bladder. Your kidneys also help regulate your blood pressure. So there are two types of dialysis, which is hemodialysis and peritoneal dialysis. So let's define hemodialysis. So hemodialysis, an artificial kidney or hemodialyzer, is used to remove waste and extra chemicals and fluids from your blood. To get your blood into the artificial kidney, the doctor needs to make an access or entrance into your blood vessels. This is done by minor surgery to your arm or leg. Um, Sometimes an access is made by joining an artery to a vein under your skin to make a bigger blood vessels called fistula. So, however, if your blood vessels are not adequate for fistula, the doctor may use a soft plastic tube to join an artery and a vein under your skin. This is called a graft. Occasionally, an access is made by means of narrow plastic tube called a catheter, which is inserted into large vein in your neck. This type of access may be temporary, but it's sometimes used for long-term treatment. So, what happens before hemodialysis? So, before you start hemodialysis, you'll undergo a minor surgical procedure to make it easier to access the bloodstream. You may have artery, arteriovenous fistula or AV fistula. A surgeon connects an artery and vein in your arm. Second is arteriovenous graft or AV graft, which is if the artery and vein are too short to connect, your surgeon will use a graft or soft hollow tube to connect the artery and vein. So AV fistulas and grafts enlarge the connected artery and vein, which make dialysis access easier. They also help blood flow in out of your body faster. So if dialysis needs to happen quickly, your provider may place a catheter or a thin tube into a vein in your neck, chest, or leg for temporary access. So your provider will teach you how to prevent infections in your fistula or graft. This provider will also show you how to hemodialysis at home if you choose to do so. So, what happens during hemodialysis? So, during hemodialysis, the dialysis machine removing a blood from a needle in your arm circulates the blood through the dialyzer filter, which moves waste into dialysis solution. This cleansing liquid contains water, salt, and other additives. So return filtered blood to your body through a different needle in your arm. Monitor your blood pressure to adjust how fast blood flows in out of your body. So what happened after hemodialysis? Some people experience low blood pressure during or immediately after hemodialysis. You may feel dizziness or you may faint. Other side effects of hemodialysis include chest pain or back pain, headaches, itchy skin, muscle cramps, and restless leg syndrome. So, how long do hemodialysis? So, the time needed for your dialysis depends on how will your kidney work, how much fluids, weight you gain between treatments. Kasi before and after, minomonitor yung weight ng patient before dialysis. So, third is how much waste you have in your body, how big you are, the type of artificial kidney use. Usually, each hemodialysis treatment lasts about 4 hours and is done 3 times per week. So, the second types of dialysis is the peritoneal dialysis. Let's define it. So, with peritoneal dialysis, tiny blood vessels inside the abdominal lining or peritoneum filtered blood through the aid of dialysis solution. This solution is a type of cleansing liquid that contains water, salt, and other additives. So, what are the different kinds of peritoneal dialysis and how do they work? There are two types, which is the there are several kinds of peritoneal dialysis, but two major ones are. So, the first one is the continuous ambulator peritoneal. Second is the dialysis or CAPD, and automated peritoneal dialysis or APD. So the first one is the continuous ambulatory peritoneal dialysis or CAPD. It is the only type of the peritoneal dialysis that is done without machines. You do this yourself, usually 4 or 5 times a day at home or at work. You put a bag of dialysate about 2 quarts in your peritoneal cavity through the catheter. The dialysate stays there for about 4 or 5 hours before it is drained back into the bag and thrown away. So this is called an exchange. You use a new bag of dialysate each time you do an exchange. While the dialysate is in your peritoneal cavity, you can go about your usual activities at work, at school, or home. So the second one is the automated peritoneal dialysis or APD. It's usually done at home using a special machine called a cycler. This is similar to CAPD, except that a number of cycles exchange occur. Each type cycles usually last about 1 or 1.5 or 2 hours, and exchange are done throughout the night while you sleep. What happens before peritoneal dialysis? So before peritoneal, about 3 weeks before you start peritoneal dialysis, you'll have a minor surgical procedure. A surgeon insert a soft, thin tube, or we call catheter, so through your belly and into the peritoneum. This catheter stays in the place permanently. So a healthcare provider will teach you how to perform peritoneal dialysis at home and prevent infections at the catheter site. So what happens during the procedure or peritoneal dialysis? So during peritoneal dialysis, you connect the catheter to one branch of a Y-shaped tube This tube connects to a bag that has dialysis solution. The solution flows through the tube and catheter into the peritoneal activity. Disconnect the tube and catheter after about 10 minutes when the bag is empty. Cuff off the catheter. Next one is the go about your usual activities while the dialysis solution inside the peritoneal cavity absorbs waste and extra fluids from the body. This process can take 60 to 10 minutes, 60 to 90 minutes. Remove the cup from the catheter and use the other branch of the Y-shaped tube to drain the fluids into a clean, empty bag. So, lastly is that repeat this step for 4 times a day. You sleep with the solution in your stomach all night. So, some people prefer to peritoneal dialysis at night, which with automated peritoneal dialysis, a machine called cycler pumps the fluid in and out of the body while you sleep. So, what happens after peritoneal dialysis? The liquid in your belly can make you feel bloated or full. It might feel uncomfortable, but the treatment isn't painful. Your stomach may stick out more than usual when it's filled with fluid. So, what is the risk or benefits of this dialysis? So, what are the potential risks or complication or of hemodialysis? So, some people have problems with the AV fistula or graft. You may develop an infection, poor blood flow, or a blockage from the scar tissue or a blood clot. Rarely, the dialysis needle comes out of your arm or a tube comes out of the machine during dialysis. So a blood leak detection system alerts you or the medical staff to this problem. The machine temporarily shuts off until someone fixes the problem. This system protects you from blood loss. So, what are the potential risks for complications of peritoneal dialysis? This is some people develop skin infections or around the catheter. You're also a risk for peritonitis, an infection that occurs when bacteria get inside the abdomen through the catheter. So you may experience fever, abdominal pain, and vomiting. So using the abdominal catheter and pumping your belly full of fluid can weaken abdominal muscles over time. You may develop a hernia. This condition occurs when an organ like the small intestine pokes through the abdominal muscles. So you may feel a bulge or near the belly button or in the groin area between the abdomen and upper thigh. Your doctor can repair a hernia with the surgery. So during peritoneal dialysis, your body absorbs dextrose, a sugar from the dialysis solution. Over time, this extra sugar can lead to weight gain. So recovery and outlook. What outlook prognosis for someone on dialysis? It is possible to live 10 to 20 years on dialysis. Sometimes, dahil nakabantay na ako sa tito ko nung nagda-dialysis, inaabot lang ng 3 years or 4 years yung patient na mga nagda-dialysis. So, the outlook varies depending on your age, overall health, and the cause of kidney failure and other factors. So, if you get a kidney transplant, you can stop dialysis when your new kidney start working. So, yung tanong na pwede pa bang bumalik sa activity nila? So, many people on dialysis continue to live active lives. Yes, it's true. They are working, raising families and traveling. Like my tito, nag-work pa siya sa salon, sa sarili niyang salon, and event organizer din siya. So, palagi din siyang, pero may mga kasama na siya, like, mag-uutos na lang siya doon sa mga kasama niya kasi hindi niya kaya kasi bawal mangalo, ganun. So, when you travel, your healthcare provider can help arrange for you to get dialysis at a center at your new locations. So if you're doing either type of self-dialysis, you can take dialysis solution bags and the portable home dialysis machine if needed with you. So people who use peritoneal dialysis may need to limit exercise or certain physical activities when the abdomen fills with dialysis solution. Yung mga hard exercise sa home or even the gym, hindi na po pwede. So, otherwise, exercise is typically okay for people on dialysis. You should ask your provider about participating in specific activities or sport. So, when to call the doctor, your doctor. When should I call the doctor? You should call your healthcare provider if you experience difficulty urinating, dizziness or fainting, unusual tears, dehydration, or other signs of low blood pressure. So, vomiting, sign of infection such as fever or oozing, the redness at the AV fistula, or catheter site. So, severe abdominal pain, unusual bulge in the abdomen or groin, hernia. A note from Cleveland Clinic. It is reference for the Cleveland Clinic. So, dialysis is a life-saving treatment for people with kidney failure and renal disease or ESRD. You may stay on dialysis indefinitely or just until you may get a kidney transplant. So there are different types of dialysis. Some people are prefer to do dialysis at home while others want to go to hospital or dialysis center. Um, Meron kasi dito sa CDHI, binabayaran kaya yung mga taga ibang munisipyo or dito yung tito ko, dati sa CDHI siya nagda-dialysis. So, lumipat siya dito sa San Andres kasi, um, ano, libre lang dito. So, your healthcare provider can review dialysis options with you to find a treatment that works best for you. Meron din sa EBMC ng libreng dialysis, pero ano ka pa ulit, magpapa-fill up ng form, ganun. So, that's all. Thank you.